So, good afternoon. We are excited that you have joined us today for the panel on creating effective environments. And we are trying to maximize the learning potential for each learner. And I am so excited about the lineup for this afternoon. And I know that you are too. I know that we are all inspired and on fire with the plenary this morning. But I want to tell you that this afternoon's panel will be no second runner up. And so this afternoon, we have several panelists who are nationally and internationally known, and they are considered some of the best in the field. And I'm just excited that I get to hang out with them this afternoon. And so you will hear across this afternoon from Dr. Lisa Fox. And I know that if we were all together, I could hear those applause. You'll get to hear from Tatiana DeGrassa. You'll get to hear from Dr. Douglas Fuchs, and you will also hear from Dr. Steve Goodman. And so to start us off this afternoon, I'd just like to set the tone by just reminding us that even though each panelist will have a distinct area of expertise, that all of this expertise must come together to ensure that we have an appropriate learning environment for our students. And so here's what we know. We are committed to excellence and success for every student. We know that even before the pandemic, that some of our students were underserved and under-resourced. We know that the pandemic wasn't necessarily kind to any of us, but definitely disproportionately impacted some of our subgroups and some of our students. As we continue to think about that, we must consider the holistic needs of each student. We recognize that there are non-academic factors that impact the academic learning process for our students. And here's probably the most fundamental part that makes what this panel will do this afternoon so unique. We recognize that learning was not lost. Opportunities for learning was lost. And as we try to recover those opportunities for learning, we must be sensitive to the reality that our students are tired. Our students are impacted by learner fatigue. We also have to design and maximize opportunities for learning by recognizing that we are still in the midst of a pandemic that goes beyond COVID-19, but it is the pandemic of the teacher pipeline by which many of our invaluable resources, I'd like to say some of the most invaluable resources, are burning out in the field. And so I'm just looking forward to hearing from many of our guests this afternoon as they guide and facilitate us with solutions and just help us to think about the work and reimagine the work in a whole different way. And so I'm going to start by introducing Dr. Lisa Fox. She is a professor with the University of South Florida. Dr. Fox is a professor in the Department of Child and Family Studies and the co-director of the Florida Center for Inclusive Communities, the University of South Florida Center for Excellence in Developmental Disabilities. She also serves as the co-division director for the Florida Center for Inclusive Communities. She has a PhD in early childhood special education from Florida State University. And she was a faculty member in the Department of Special Education for the University of Florida prior to her commitment at the University of South Florida. She was the principal investigator of the OSEP-funded Technical Assistance Center on Social Emotional Intervention for Young Children and a faculty member with the Center on the Social and Emotional Foundations for Early Learning. You can always find additional information in Dr. Fox's bio, but this afternoon we are so fortunate to have you join us. Welcome, Dr. Fox.
Thank you. Thank you so much. I only have a short amount of time, and I'm going to begin our discussion talking about our youngest learners and how we maximize learning opportunities for them. So if we can advance the slide. So we're going to be talking about 3 to 5 year olds coming to school in the fall. And think about, some of these children have had no experience in a classroom ever before. Some children have been receiving virtual services. So this is their first time with peers, and kind of a very unique fall semester, right? I want to point out to you, since I only have 10 minutes to share with you just some ideas about how we maximize learning opportunities for little ones, that we've captured my comments and the practices that I'll be discussing in this reopening guide. And I think if you click, you can see the next page of slides animated. So this guide will give you more information about these practices I'm going to talk about. And it includes these embedded hyperlinks that both program leaders will find useful, as well as classroom teachers, that link to materials to be using as we reopen schools. So I want to move to the next slide, and I want to start with how we welcome families. So we're going to start there with our family practices. In early childhood education, and of course in all education, our partnerships with families are really critical to children's learning. In early childhood in particular, especially when we're talking about little ones coming to the classroom, the stronger our relationships with families, the more likely that we can really impact that child's learning trajectory. And so in this time in particular, we want to think really deeply about maximizing our opportunities to build relationships with families. And of course, relationships are built through interactions. So even before the child enters the classroom door, think about what we're doing to engage with families, to communicate with families. And of course, our major messages are going to be what to expect when children come into the classroom, our expressions of safety and support, our eagerness to listen and to learn, and then to gain an understanding perhaps of what's happened when children weren't with us in these past 19 months or so. So in that reopening guide that I shared with you, we have a format for gaining some information, kind of a carefully structured interview questionnaire for trying to find out more about what has happened to children and families when they haven't been with us in our classrooms. So let me move to the classroom practices. If you'll go to the next slide. I want to talk about 3 areas of critical practices. And what we believe, or framing these as pivotal practices, we believe that if we do these really well in the first few weeks, first month of opening our classroom doors to preschoolers, if we do these really well, then children will be more engaged. Problem behavior will be prevented, and children will have more opportunities to engage in learning in their early academic learning. So the first one is about relationships, and that's here because, of course, the big task for a teacher is establishing relationships with children as they enter into the classroom. Think about children who've been away and maybe even out of very many social networks prior to entering the classroom. So we're going to have to work a little harder and be far more intentional about creating relationships with each and every child. And what our goal there is, of course, that children feel safe, they feel comfortable, that then they are more able to engage in learning and feel more capable in persisting at hard work, which might be engaging in learning opportunities. So relationships are critically important. What we want is for teachers to be planful about that, to be ready, to not rely on relationships just to evolve, but to be very intentional about what they're going to do to connect with each and every child as well as their family. The second area of pivotal practices are predictability. Predictability is critically important. This morning we heard mention about trauma-informed, having a trauma-informed care approach. We know predictability is very critical to children exposed to trauma. Predictability is very important to kids who may have been in unpredictable environments. But it's also important for that child to be able to navigate the learning environment. And so we want teachers to be ready to invest a lot of time in helping children know what to do, when to do it, and the expectations of the classroom. We also want teachers to be ready to provide materials so that every child, children who may learn that quickly and children who may struggle with understanding that, can understand the schedules and their routines and the expectations. So if you move to the next slide. So the last area I want to talk about is social emotional teaching practices. And we believe that this should be the major focus of instruction in the first few weeks. So children are going to come back to the classroom or come newly to a classroom with some big emotions. And those big emotions might be, I'm so excited to be back, and I'm having a hard time settling down and focusing. Or it may be, I've had such a hard time that I can't quite navigate this environment and social relationships. And so we want to spend time, we want to be ready, we want to be intentional with our instruction and ready with materials to be able to guide children who might learn these quickly, as well as children who are going to struggle more. And so there are 4 areas that we think are critically important in terms of social emotional competence that should be the focus of instruction in those first few weeks. If you'll go to the next slide. So our first area we call friendship skills, and really they're peer relationships and as well as relationships with adults. But what we want there are intentional instruction on how to be a part of a group. And if we think about the child who may not have been in group care or might not have been with many peers, this is going to be pretty new to them. Our little ones are really evolving in their social emotional development. And so what they need here is instruction in how to be a member of a group, how to initiate a social interaction, how to take turns, how to assist others, how to create that classroom climate of support for each other's. The second area on the next slide. Next slide, please. The second area is what we call emotional literacy. And emotional literacy is about the ability to understand and express emotions within yourself and understand the emotions with others. And I referred already to children coming to school with big emotions. And so that might be they're excited or apprehensive or anxious. But what we want is to be able to guide children in their emotion expression, right? We want them to express their emotions in healthy ways and understand the emotions of others. And we want teachers to be able to respond to emotions, even strong emotions, with curiosity about what that child is communicating, and then with instruction to help that child be able to express their emotions in appropriate ways. The third area for instruction, and that's on the next slide, please, is around self-regulation. So if children have big emotions, then we need to help them understand what to do with those big emotions that can get in the way of engagement and can get in the way of learning and peer interactions that are so vital to the early childhood classroom. And so being able to regulate their strong emotions, being able to calm down when they have strong emotions is critically important. And then the fourth area, if you go to the next slide, is social problem solving. So again, think about the child who's new to navigating an environment where you share the attention of a few adults, 1 or 2 adults with 15 to 18 other children. The ability to navigate peer conflict and resolve social problems. And so we want to be able and be ready to teach that explicitly so that children can engage in learning with their peers. And then finally, on my last slide, just a few messages for you who are program leaders. I think then there are practices that we need to do to make sure that all of this can happen, the kinds of supports we need to provide to our teachers. So we want to make sure that even if teachers are anxious about helping children catch up or to learn or to engage or to get busy with their IEP goals, what we want to do is assure them that placing a priority on teaching social emotional skills and helping that classroom community kind of make that community happen and help kids be calm and engage in learning is our priority. We want to pay attention to staff wellness, have an ear open when staff have concerns, to really listen. And then we want to communicate that message that our connections with families are critically important, that will support teachers in doing that and create more opportunities to make that happen. So I think I'm at my 10 minutes, so thank you very much.
Dr. Fox. You did an awesome job, and thank you for sharing that information. And as I was just listening to you, here's something that really jumped out at me with that content. You kept emphasizing that really relationships matter, and they matter even for our most youngest learners. And here's the key, that we have to be intentional about those relationships, and we have to do it with integrity. And so now, as we consider the impact of learner fatigue for any of our learners, especially for our most youngest learners who probably didn't have all of those relevant experiences that some of our older learners have. What is it that we need to think about and do differently? So we thank you for that content, and we're looking forward to just probing you to ask some additional questions later on during the panel. But thank you for that sharing. And so as we continue on, I'd also like to introduce you this afternoon to Tatiana DeGrossa. She is a parent group specialist for the Southeastern region of New Jersey and a co-director of the Start Engaging Parents of Students with Disabilities School project. Tatiana is also a special education volunteer advocate and a trainer for Southern New Jersey. And so her advocacy journey in special education, it actually started when her son was diagnosed with autism at the age of 5. And so today she provides a co-leadership for the Special Education Parent Advisory Group, and she is a member of the Perform Care Family Leaders Group and the Atlantic Center for Independent Living Board. And so we're just excited about having you with us this afternoon, Tatiana. And I know that you're going to share a wealth of information, just making sure that the engagement and addressing the needs of our learners continue to include that family lens, that family perspective. So thank you for being with us this afternoon.
It is my pleasure today to share our family's perspective and information and resources for engaging with families. Thank you so much, Zalphine, for such a lovely introduction. As we heard today already in the morning from our earlier speakers, the COVID-19 pandemic taught us many lessons, including lessons that challenged existing perceptions about roles of families in the education of their children and in our schools. So during my portion of today's presentation, I would like to highlight some key takeaways related to the importance of collaborating with families and share useful resources to help re-engage learners. I'm going to try to stay within the 10 minutes of allotted time, and if I won't be able to, I would like to maybe sneak in some of the additional resources and information during the Q&A portion. I would like to begin by sharing recently released results of the 2019-2020 Parents data that reveal not only the true depth and volume of important work that parent centers have accomplished in the past year, but also provide a stunning snapshot of outcomes in building effective knowledge, advocacy skills, and greater confidence of families of children and youth with disabilities in assuming leadership roles and partnering with professionals who work with their children. I'm going to give you just a quick glimpse of that data that you can find on the Center for Parent Information and Resources website. So in 2019-2020, over 1.8 million times parent centers connected with families, professionals, and youth with disabilities, almost 65% increase from the previous year. Nearly 730,000 parents attended our trainings. This number more than doubled compared to the previous year. And over 420 parents received individual assistance. This is amazing work and something that we should all be incredibly proud of and empowered by the impact families had on their education of their children and the families that we serve across the country. As you also know, that COVID-19 pandemic in many ways has exacerbated existing systemic divides that have prevailed in our society for generations. At the same time, perhaps for the first time ever, families everywhere embraced the challenges of educating their kids from home and adapted to new roles as learning coaches, reading specialists, behavioralists, therapists, principals, instructional aides, and special educators. Families, including mine, like never before experienced their virtual classrooms and instructional practices that when they're engaged in teaching and learning with their children, often sitting side by side, teaching from home on the electronic device or from the school packets. Parents facilitated new health and safety practices and social emotional connections from a distance, and created learning opportunities anytime, anywhere. Families like mine never before relied on school districts for resources and guidance on supporting our children, and rallied for greater transparency and accountability when it came to making decisions that impacted our children's learning and safety. So I would like to offer these lessons as foundational principles to engage in with all families moving forward in the fall and beyond the next school year. One of the most vital takeaways from the last year and a half is that districts need to regularly share current, understandable, and in languages spoken by families in their homes, information about school reopening plans, and continue to implement ongoing two-way communication strategies to help build trust and relationship with families, educators, and community organizations that support them. Reaching all families means intentionally creating ways for families to give input toward developing and evaluating school reopening plans. School families should also have opportunity for their preferred means of providing and receiving communication, including through focus groups, home visits, online surveys, phone calls, text messaging, email, and various virtual platforms. Another important strategy to focus on when supporting families is to engage families in a sustainable, equitable, and inclusive way. Districts need to create place and space for parents to voice their concerns, discuss issues, ask pressing questions, and find resources. It is critically important that school reopening plans include specific strategies for helping families maintain their quality of life and well-being during the ongoing pandemic, and support their children's learning at home, including address food insecurity, share information about utility, rent, childcare assistance programs, provide technology devices, internet access, information about school learning objectives, access to teachers and related services providers, as well as classroom peers. When we discuss access to learning, we must remember that when it is identified that the child needs additional support, that families are provided with information on school-based services available to them, and that information is provided in timely manner. That families are actively involved in the development of the intervention plan for their child and continue to receive frequent communication about their child's progress. Effective family-school partnerships must include a broad team of stakeholders, including administrators, educators, and diverse family and community members who participate in shared decision-making process together. Districts must ensure that there is a way for families and community members who represent the diversity of the student population, especially those students with the greatest learning and equity needs, to actively participate in the development and review of school policies and plans for reopening. Families and community stakeholders should be participating in the full spectrum of school and district level decision-making bodies, including Board of Education, special education, parent advisory groups, Title I committees, bilingual, early childhood, school health, school climate committees, and of course, school reopening committees and pandemic response teams. Another valuable takeaway from the past year is the essential role strategic community partnerships play in supporting safe and nurturing environments. Schools, as we know, cannot do it alone and must be intentional about bringing in partnerships with community organizations that support health and mental health needs of families and staff, help meet essential needs of families, offer childcare and after-school or mentoring programs, ESL classes for families, and other support programs. Schools that recognize community funds of knowledge and engage and support culturally and linguistically diverse stakeholders as partners, advisors, co-creators, and volunteers exemplify best practices that maximize opportunities for learning and for school improvement efforts. Next slide, please. We offer the following resources that help inform your work in the coming school year and beyond. And it's very hard to narrow down the amount of resources that Center for Parent Information and Resources made available to parent centers, professionals, and families. So I picked most recently hosted and most current and relevant information to inform your work and supplement my instruction. So the webinar, Vaccinations, Return to In-Person Learning, and What All Parents Need to Know, offers specific strategies and the process that needs to get our children in with and without disabilities back in the classroom in the fall for in-person learning. In that webinar, we highlight an amazing array of resources that are available in multiple languages, and that's key a lot of times when we talk about reaching all families and offering equitable information, and include information about COVID and vaccines, as well as a lot of customizable materials and communication toolkits that are tailored for specific audiences, such as families, community-based organizations, schools, and camp programs. A terrific tool for family engagement for school reopening and recovery offers the opportunity to gather a team of stakeholders to take an inventory of existing family engagement practices across 4 domains: communication, family engagement in student learning, engagement in decision making, and strategic family and community partnerships. It can be used to evaluate school-wide, grade level, classroom level, or even virtual learning platforms and existing family engagement practices, and offer specific strategies on how to implement improvement efforts. Most recently, I've been involved in the development of a video series supporting students with most intensive needs. It's a series of 3 informational videos that highlight key resources related to academic, communication, as well as behavioral, transition, and mental health needs to support families of students with most intensive needs at home and as they transition to and from in-school services during the COVID-19 pandemic. These short videos speak directly to parents and recommend that parents share videos and the mentioned resources with a team of educators and other professionals working with their child that may provide additional opportunity to build upon conversations families are having to support learning during a pandemic. And of course, I can't say enough about the volume and the depth of resources around advancing equity in our communities that are available on the Center for Parent Information and Resources. Most recent Parent Central newsletter included webinars and new toolkits and reports around disparities among students and communities of color caused by the COVID-19 pandemic. You will find there also information from the New Jersey Department of Education and U.S. Department of Education, including the handbooks that were published about school reopening safely, including special consideration for communities of color and students with disabilities. Lots of resources that stress using this reopening opportunity to promote educational equity and address longstanding opportunity gaps that have been exacerbated by the pandemic. Again, I would thank you for the opportunity to share this information today, and I look forward to our discussion and maybe elaborating on some of the key takeaways that I shared with you today. Thank you so much.
Thank you, Tatiana. That was great sharing. And it really, number one, it reminded me of probably my best lesson during the pandemic, which goes back to an African greeting, which says Sawabona. And Sawabona really means I see you, we see you. And of course, your response would need to be, yay, bo, Sawabona. We see you seeing us. And I think everything you have just said in such excellence reminds us that all we do, it's in excellence to make sure that we see each other, that we do not enter into situations where we have assumptions about what the needs are, that we do not exclude families from conversations that they need to be in the most. We know that we are definitely talking about populations, in some instances, underserved, under-resourced. We need families to engage in those conversations. And what we saw happening across the country during the pandemic, we saw districts and schools that already had those strong systems and practices to engage families. They had a much easier time trying to navigate the pandemic and continue to engage families. What we noted was obviously in instances where that was not the norm. We saw local schools and districts creating systems and processes during such an unprecedented time that made that transition extremely difficult. And so just really thinking about what we heard earlier about the young learners, recognizing that sometimes my behavior is my communication. I'm saying something to you with my behavior that may not be appropriate, but it's my language. Thinking about the role of addressing learner fatigue, but not disengaging our families in the process. So we are just thankful to you for sharing your expertise in that area. Thank you so much. And so next we are going to, it's not over yet, we're going to hear from Dr. Doug Fuchs. I'm going to call him that affectionately. And so let me tell you a little bit about his vita. And of course, you can read his bio on your own time. But he comes to us as a professor from Vanderbilt University. And he is a member of the faculty at Vanderbilt. He is a Nicholas Hobbs Chair of Special Education and Human Development. Alexander Hurd Distinguished Service Professor. I told you we're bringing you a fabulous team this afternoon. He's also been a professor in the Department of Special Education at Peabody College, Psychology and Human Development and Pediatrics. So he was a first grade teacher in a private school for children with behavior problems or children who demonstrated their communication in a way that probably wasn't the most appropriate for others around them, right, Dr. Fuchs? But then also he was a fourth grade classroom teacher in a public school, as well as a school psychologist before moving to Vanderbilt. When we look at his resume, he has directed 50 federal research grants, and he has published over 400 articles. So when you are talking about research, I doubt that you will go very far without referencing some of what he's done in these 400 articles or in these 60 books. And so we are excited to have you with us this afternoon. And we know that you're going to share a wealth of knowledge and expertise to help get those questions going, because we haven't figured this out. And we want to be able to maximize learning for each learner. So welcome this afternoon.
Thank you, Zolfina. I just want to say that Zolfina, I think that you are the host, facilitator, maitre d' par excellence. I've really enjoyed your gracious, the gracious role that you're playing here. It's really wonderful, and I also want to say to Lisa and Tatiana that I really enjoyed their presentations as well. I'm going to be talking. So Lisa focused very effectively on young children and specifically their social emotional development and needs in this very strange, difficult time we're in. And Tatiana spoke eloquently about the relationships between and among parents and families and communities and children and youth with disabilities. I'm going to speak about school-age children, and specifically school-age children at risk and school-age children with disabilities for a little bit, and specifically focusing on some academic strategies that schools might consider for accelerating the academic growth of these children and youth. Next slide, please. One of the many problems that we all face is that there is an obvious and important need to address the effects of remote schooling on the reading and math performance of these children about whom I'm speaking, those with and without disabilities. And this includes many, many students across the achievement continuum whose academic progress has slowed, stopped, or even regressed. There's lots of estimates of how much loss there's been in academic performance, and it ranges from shockingly large to encouragingly not so much. I'm not sure how accurate all of these estimates are. I think it's safe to conclude, and it's commonsensical, that there has been loss, and as has been expressed already, the loss is no doubt exaggerated among children at risk. So there is clearly a problem. The question, or a question, is, as schools reopen, how can instruction and intervention be structured, be organized to address the near universal loss of learning and reduce the widening gaps, learning gaps between students with disabilities and non-disabled peers. Next slide, please. So what I'm going to suggest is that to serve this broad range of achievement levels that existed prior to the pandemic and continues, we must and expand the effectiveness of general education, instruction in the general classroom, with evidence-based programs, and specifically evidence-based programs that take advantage of the presence of children sitting next to children. That is to say, there is a large handful of oftentimes unrecognized but very effective class-wide academic programs that structure differentiation with practical routines and which provide evidence of boosting learning across the achievement continuum. Next slide. What I'm speaking of is a group of evidence-based practices that is sometimes referred to as peer-mediated instruction or peer-mediated education. Examples of these programs include, and I'm sure some of this will sound familiar to some of you, cooperative learning, class-wide peer tutoring, reciprocal teaching, and peer-assisted learning strategies. Each of these programs, across many studies over many years, has shown that when these programs are implemented by educators with fidelity of treatment, many children benefit. Many children with and without disabilities benefit. Not all, and I'll come back to that, but many do. And what's really, I think, advantageous about these programs is that they don't take over a curriculum. They don't take up a majority of instructional time. In fact, they take up a relatively small proportion of instructional time and can be used with different curricula, all different curricula, sometimes representing very different perspectives on what learning and teaching is about. I want to talk a little bit about peer-assisted learning strategies, or PALS, in reading and math. These are programs that my colleagues and I at Vanderbilt have developed over 15, 20 years. Let me just briefly describe these PALS reading and PALS math as peer-mediated programs. All students in a class work in pairs. One child in the pair is lower performing and the other is higher performing. They are partners. They're trained to work together cooperatively as partners on structured activities 2 to 3 times per week, 20 to 30 minutes each session. So you see, it's relatively infrequent. It is not time intensive. PALS reading and PALS math and the other peer-mediated programs can create routines with which teachers may modestly differentiate instruction across their students by creating many simultaneous peer-mediated lessons rather than one teacher-directed lesson. In other words, the teaching and learning process for this period of time is decentered. Teachers are not on stage. The teaching and learning is now taking place, if you think of a class of 26 third grade children, in 13 pairs. And what pair 1 is doing might be a little bit different than pair 2. In reading, it may be that one pair is reading out of a slightly more advanced text than another pair, as an example. Peer-assisted learning strategies has been shown to benefit high, average, and low-performing students because working with a peer provides extensive practice with immediate feedback in an engaging way, which offers opportunities for students to frame explanations while activities are somewhat differentiated to address the individual learner needs. Next slide, please. Students with the most severe learning loss and achievement gaps receive individual or small group intervention from well-trained adults using validated platforms with data-based individualization. For these students, for the students with the most serious learning problems, learning gaps, learning delays, differentiation or accommodation in the general class context is important, but it is not a substitute for the targeted, more intensive intervention they require to make meaningful progress. Let me say this in a different way. What I'm suggesting here is peer-mediated instructional programs offer classroom teachers a very viable way of enhancing the teacher's own instructional efforts. It complements, it supplements, it fortifies many teachers' efforts to accelerate their children's progress in areas like reading and math. For many kids, the combination of teacher instruction and peer-mediated practice will be sufficient to get kids back on track. It will not be sufficient for all children. In every classroom, there will be some number of children who need something more and who need something different. And we need to recognize that different strokes for different folks. And these children with serious learning needs and problems need an intensity of instruction that, quite frankly, folks, was missing from many classrooms and many schools before the pandemic. And so, as I think Zelfina said at the outset, the pandemic, in a sense, provides an opportunity for reset. Not reset necessarily to exactly what we were doing prior to the pandemic, but reset after thinking how we might improve what we were doing before the pandemic hit to make education more meaningful for all children. And I think I'll stop there.
So, Dr. Fuchs, you get a hand clap for me. Listen, I know that we are preaching to the choir this afternoon, but I want to repeat something I heard him say earlier. The educational process matters. Our students with disabilities are general education students first. And I will be just candid. I don't think we say that enough. And I think we hang the hats and the responsibility and the accountability for students with disabilities who have the resource of IDEA exclusively on special education. But special education cannot fix a broken educational system. And so what he has just described is really what we heard earlier. You know, with our educational system, we have to be consistent and reliable. I have asked this question countless times. How many of you would sign up for elective surgery with a surgeon who doesn't have a 100% success rate? The reality is you wouldn't do it. However, our students don't have that choice. They don't pick and choose their surgeons. They go to school based on the communities that they are in. And if every student is going to succeed, it has to be more than an act. It has to be persistent. It has to be consistent. It has to be reliable. And all of our students matter. So that means exactly what he just described. We have to give each student the tool that he or she needs to be successful. We have to have a reliable system. And I'm just appreciative of the tools that you shared this afternoon, and really the research, the evidence behind it. There has to be science, right? We can't only talk about the science with masks. We have to talk about the science with the type of instruction and interventions that we are putting in the front of our students. And I'm appreciative to have served with you this afternoon. Thank you so much. And so now, as we get ready to pull up our last panelist for this afternoon, last but certainly not least, I'm sure that you are familiar with Dr. Steve Goodman. He's actually the director of Michigan's Technical Assistance Center for the Multi-Tiered System of Support. So talking about bringing it all together in a framework, because we have to be predictive, we have to be reliable, and we have to have the science. He's actually a partner with the Center on PBIS. So we're bringing all of those pieces together, academic and behavior. And he is an advisor to the National Center on Intensive Intervention. And so Steve is a team member on the National MTSS Research Network, and he's actually served on Michigan's Literacy Commission, and he was president of the International, did you hear me? He was president of the International Association for PBS, and he's actually co-authored over 45 publications. And so join us this afternoon, Steve, and get ready to take us home.
Thank you so very much. Such an honor and a pleasure to be here, especially with the, the colleagues who presented before us. They set up such great information. I've got kind of three parts that I'm hoping to connect with you during my brief time. The takeaway messages, the first one includes invest in school climates that really promote and emphasize effective practices and procedures. The second takeaway message is how do we connect and align and integrate social-emotional behavior supports with academic supports? And finally, the final takeaway message is we really need to invest in systems to support educators to really implement these effective practices with fidelity. So next slide, please. So when we talk about looking at setting up effective climates and cultures, I want you to consider this, that we need to really focus on common vision. And within this common vision, we really want, or this successful climate and culture, we want to focus on a common vision, common expectations, experiences, and language. And for all that, we know that our students and families and educators really have been interacting in a variety of learning contexts that has changed significantly in the last year and a half, from virtual, hybrid, and in person. And that environment is really have been challenging for some. Some students have been much more successful, but either way, we're changing again as we're moving forward. And you heard the discussion early on in the morning, we need to build back better. And this was important with looking at what we're doing for school climates pre-pandemic, but there's an opportunity and even a more important focus to create these successful climates now. We need to consider the needs of each and every student, our historically marginalized students, our students with disabilities, in developing this climate and culture. And what's really important is that for students with disabilities, we know that the majority of students with disabilities spend the majority of the time in general ed settings. So there's a feeling of urgency to make this work, but also the how the students may react more sensitively to successful climates. So we want environments that are positive, environments that are predictable, that are safe, that the environment is consistent, because we've had a lot of perhaps unpredictable different events that have certainly affected our students and teachers and educators and families during this past year and a half through the pandemic. And we want to tie it all with effective instruction. The next slide, please. So when you look at this document, this was actually created by a friend and colleague of mine, Brandy Simonson from the PBIS Center, along with her colleagues as well. What we look at, we need to get back to basics to really make sure that we're creating effective environments. Part of that idea is the basics focus on the main, most important ideas to address, but also because of the feeling that we've gone through so much. Educators are overwhelmed, students have been overwhelmed, families. So how do we get back to the simple things that will give us our biggest bang for the buck, or high leverage practices for that? So when you look at this, what we do know as a high leverage practice is if we can set up environments where students, educators, families know what behavior expectations are, we teach those expectations, we don't leave it to chance, because there's been a lot of changes over time. We want to come back and center everyone on what we're doing in these environments, the context. But we also want to provide very specific feedback on students who are engaging in these expectations. So when you look at this, it's kind of these 5 areas. We need to make sure we're developing relationships with others. We need to connect. When we talk about instructional lost time, we have this lost time of making these connections. So with relationships, so focus on connection. We need to screen to see what are, and when we talk about screening, it could be informal, it could be more formalized process, but we need to gather information. And then we need to develop supports to prevent and to invest in intervention. And throughout all this, we don't leave it to chance. We teach and we monitor. So we have this cycle going on to say, how do we uncover needs? How do we make sure supports are provided? And how do we monitor that to move forward? There's certain really high leverage practices that cut across all these areas. For example, Clay Cook from Minnesota did research on positive greetings at the door, where you can greet a student and either at the door physically or virtually in the meeting room. Make sure that you're making connections. We can tie it into the screening process to say, are there things that we are learning before the student is beginning or that has happened over time that may contribute to a greater need for support? We set up that support and teaching during that time of what are positive, how do we have socially appropriate positive interactions for our given context. And then we monitor and make sure that all that's going on. So there are practices that can tie this right across each of these five items. The next slide, please. One other thing in this idea is we need to connect the academic with social, emotional, behavioral. So if you look at the slide, we certainly see on the right side the academic areas, the content areas, history, science, math, literacy. On the left side, you can see the non-academic, the social, emotional, behavioral, mental health. And what we see is that we know that you can't separate those. It doesn't help separating those to seeing the needs of the student, but there's such an interaction. So if I am struggling academically, it may manifest itself or demonstrate that I engage in problem behavior to escape those academic demands because I can't compete with my peers, or I don't want to look like I don't know what I'm doing. So we know that they're interconnected with the academic and social emotional behavioral. What we also know is that there's an opportunity to better integrate during this time as we build back better. So we can look at what are the social emotional behavioral competencies. We can teach those separately, but we need to integrate that within the content areas. So it may start out that we focus on behavior expectations, or we focus on looking at monitoring our own emotions, but we tie that in, that it's embedded within our literacy sessions or our math sessions. Now, there could be things that happen that influence in our community. For example, what if there's, as we're seeing an increase with a Delta COVID variant, it may be that changes our instructional platform again, and we may need to do some things different. At that time, we may have to go back and teach separate items, but we bring it back together again. So ultimately, we want to say, integrate these items. It's going to help students. It's going to be more efficient for staff. But integration doesn't mean you do it once and now we're integrated. It means we have to be responsive and really rely on the data to see where our needs are. Can you go to the next slide, please? So the final, I talked about the importance of school climate. I talked about looking at integration. And what we also know throughout all this time is how do we support educators to do all this well? We do that by making sure that we have integrating it through single teams or a smaller number of teams, because we don't have the luxury of doing so many things. We are trying to accelerate, trying to get back and move forward. We also need to provide time and priority for implementing these social emotional behavior supports. With so much emphasis on instructional time loss, we may forget that there has been a lot of this relationship or social emotional time lost as well. We want to make sure that materials are provided for doing the work well, and provide access to professional learning, training, coaching, or technical assistance for that. If you go to the next slide, please. So through this, what we do know is that from the National Implementation Research Network, the work from Dean Fix and Karen Blasi, and now Karen Ward, that there are things that we focus on for implementation drivers, such as leadership driver, competency driver, or organization. A different way to say that is when we look at leadership and management, we need that in place to help implementers to know what to do, why do it, and provide systems to get it done. We need professional development to provide how to do it, and we need to promote effective environments to make it easy to do it right. And if we do it in that sequence, it's going to help us to make sure we are implementing with fidelity. So my discussion here for this short time with you is that we wanted to improve school climates, we want to connect academic and social emotional behavior, and we want to support educators to implement well. Key recommendations that cut across all those. One, look at your data. We want to be responsive. We want to make sure we're addressing the needs, link the interventions and support to match need, and set up systems to be responsive and focus on the impact. And I thank you for your time.
Thank you so much, Dr. Steve. And I love your ending. And it just reminds me of kind of my own opportunity to learn that kids just won't benefit from instruction and interventions they don't receive. And so I love the focus on fidelity and implementation to force us as educators to ensure that there really is a science behind what we're providing kids with the access to, that it's implemented the way it really should be implemented, and the tools are in place, not just for kids, because you noticed at the beginning, I also talked about the teacher burnout. The teacher burnout is real. And so the benefit of what you just described would require us to have systems in place, not just for the students, right? But also for our teachers and our leaders, because if 80% of our students aren't responding, that's not a student issue. And it's also not an individual teacher issue. And so what is it that we can do to ensure that we have predictable systems in place that help us to be effective and help us to address and maximize that learning for each of our learners? So awesome, awesome, awesome. I'm excited about having all the panelists perhaps rejoin me, because I see several questions that I think will just kind of enhance our sharing this afternoon. And Dr. Doug, the first question, you kind of sparked this interest for one of our guests this afternoon, and it really goes back to the kind of the question mark of general curriculum and creating that balance with intensive intervention. And so you've kind of shared some information about intensive intervention, but there's really a question mark, like, how do I strike that balance? How do I make sure that kids are getting access to the curriculum, but also addressing the intensive needs for the intervention as well?
Right. And it's an excellent question. And it doesn't, unfortunately, it does not have an excellent answer. Or at least I don't have an excellent answer. How we balance, there's not a cookbook to help educators with this issue. I will say that I think balance is the operative word. We have to respect the importance of the general curriculum. The general curriculum represents what children and youth without disabilities are engaged in or learning from, and it's the curriculum that students with disabilities should be in to the extent possible. And I think a realistic take on this issue is there are actually more than just a few students with very serious learning needs for whom placement in the general curriculum, period, is not realistic. And indeed, it's harmful. When a child is reading at a second grade level and she is in the 5th grade trying to read a social studies textbook, that child needs something more than placement in the 5th grade general education curriculum. How that's done, whether it's done through intensive intervention delivered through a so-called pull-in process or a pull-out process, whether it's being delivered by a reading specialist or a special education teacher or somebody, is something that educators at the building level, not the district level, I don't think, the building level, need to grapple with. And balance, I think, should be the watchword.
So thank you for sharing that. And is there another panelist who would like to jump in here as well?
This is Tatiana. I would like to jump in, if I may. I think all throughout this presentation, we sort of focused on all of these important critical aspects of our children's education, academic, specifically behavioral, communication, beginning from early childhood and as they go on post-secondary education. And I think no matter what placement or program we're talking about, specifically when we talk about students with disabilities, whether they're learning needs or behavioral needs, intensive needs, or more of a support, that could be met with an inclusive classroom. I think all of these interventions and the level and intensity of it and partnership between their general education and educator and a special education, these conversations cannot be happening without parents being in the know, parents being informed about what is happening in the classroom, what a student classrooms, but also focusing really on the strength that every student, no matter what their disability is or needs are, whether they're been there before pandemic or exacerbated by the impacts of the pandemic and opportunity for opportunity loss. I think parents need to receive that current and clear information about the level of support their children know, and have the opportunity to also share what they have learned by working with their children in the home, especially last year when in March, when all schools in the nation closed down due to the COVID pandemic. Parents, for the first time, were a lot of times the only people who monitor their child education or implement a general curriculum and have a wealth of information about their child's levels and needs and support that they may have. So including families and family members in this conversation, professional learning communities, and providing strategies, observations, what works for them in the home, to inform educators' practices and the supports that now are available to students in the classroom, virtual or in person, is really key, and we can't forget that. So I just wanted to stress the importance of open and ongoing communication with families, sharing data with them, helping them understand data, and providing opportunities for them to implement strategies at home and go back to the table and brainstorm with educators what worked, what didn't, and always seeking the opportunities, no matter what the level, the needs level of each student's, for them to be included, fully included, and participate in their school community, academic or not an academic. Thank you so much.
Thank you, and awesome sharing as we hear Mother Nature probably in my background, but we're going to keep on moving forward. And as we just, I want us to kind of put on the fiscal hat, and we're so trained to understand that IDEA funding, it supplements, right? It doesn't replace your local maintenance of effort. And so I think that's also critical as we see those questions in that thread, because we know that we're all trying to process, how do we do our best by providing that intensive supports for special education, but not replace what should be happening in general education, but really creating that equitable outcome. And so again, one question brings us back to the concept of pull-out or inclusion, right? And so one particular question asked specifically, we would like to better understand the context of intensive instruction. And there seems to be an understanding that intensive instruction automatically means pull-out, being pulled out of the classroom and not allowing the child the opportunity to benefit from instruction with non-disabled peers. And so I want any of you who'd like to speak to that for a moment, kind of that whole combination of meeting kids where they are, but also addressing the perception of having to be removed from the general education environment. Any takers? Dr. Steve, I see you're smiling.
Because I was waiting for Doug to jump in and take that one as well. One thing, just to start it out, I do think it's really important to let's focus on what we're trying to accomplish. So always getting back to what is it that we're measuring, and is the student making progress of that? Just to be very clear. So I think that as part of it is make sure that we've got adequate systems to monitor, and we all agree on what the goals of the education program for the students are. Related to that, I would also think it's really important that I think, as Doug mentioned earlier, I think we can do more in helping educators implement really intensive programs. It's not an easy job, right? You have to have content knowledge, you have to have the curriculum knowledge, you have to have understanding of how to orchestrate all that within complex settings. So part of it is also in the context, how do we make sure we're supporting those interventionists and orchestrate across the the schedule of the day.
Yeah, I'd like to, if I could, I'd like to just quickly add to Steve's good points. Intensive intervention is not just two words strung together. Intensive intervention refers to really a body of knowledge that has accrued over the last 30 or 40 years. And it refers to a back and forth between working with children, instructing children, taking data, assessing how they're doing, how they're responding to the instruction, modifying the instruction, assessing them again. So it's a kind of continuous test, teach, test, clinical process. And it really requires expertise. And the good news is that we have evidence-based forms of intensive intervention. And we have a few, not nearly enough, but a few training programs around the country who prepare young people to eventually become very strong, expert instructors working with children with very serious learning problems. So, I think, again, it's a balance. I mean, I think that we should maximize the amount of time, quality time that students with disabilities are in the same setting as their non-disabled peers, learning as much as possible what their non-disabled peers are learning, but at the same time, giving these children the opportunity to strengthen the skills that they will absolutely need in order to be successful through school and beyond. This is not, these two things do not exist mutually exclusive of each other. They have to somehow be brought together.
Thank you. And we did get additional clarity for that last question. And it was really coming back to how do we kind of move the needle on the appropriateness of providing that intensive instruction. And if it needs to happen outside of that environment, it's okay because it's the right thing for the child. And I think some of that, and I'm sure you will agree, goes back to the INIDEA. It comes back to an individualized decision that has to happen within that context of that IEP team and with the people who know and understand the child the best. And Dr. Fox, I'm coming to you next before we kind of do our round robin sharing at the end of it, because I really want you to give us wisdom, thinking more specifically about the young learner fatigue. School districts did absolutely what they needed to do to serve our learners. And in many instances, sometimes that meant young learners were online, screen time, 5 hours, 6 hours, 7 hours. It was sometimes not necessarily aligned to what the pediatrician said should happen for screen time to include other opportunities. So let's talk more, because even though we're returning to the classroom, what we know is in some instances, students may remain virtual. Talk to us from the perspective of learner fatigue and the young learner.
Well, I've seen wonderful examples of people delivering instruction virtually in a way that's engaging for children, engaging for the caregiver who's involved in guiding that child and providing that child with practice opportunities. So I will invite you to go to ECTA and look at Preschool in the Pandemic for some really amazing illustrations and very gifted teachers who are able to provide that instruction to children. Yeah, we're all concerned about screen time, but really the issue is about child engagement, right? How much they're engaged in learning and whether or not they're active in that. And so when early educators do that in a way that's balanced and that makes sense to children, and then we partner with families to provide either extension activities or more practice opportunities, or give tools to do that. Clearly, being in front of the screen to get all of your learning as a preschooler is probably less than what we would hope for children. We really rely on the preschool classroom as being that introduction into being in a group, being able to learn with others, being able to develop those really critically important relationships with teachers and with other children. But I want people to worry about less that it got delivered on the screen and think more deeply about what the content is, how engaged a learner is, whether or not children are benefiting from what's being delivered when we have to resort to a less desirable mechanism for delivering instruction. And before I leave, I want to also, because I'm talking about the early learner, and we just talked about systematic instruction and the use of science for instruction, that's an issue too for early childhood. And even though I stress social emotional learning, there's social emotional learning delivered with intentionality and with precision, and with the use of appropriate prompt hierarchies and systematic instructional techniques. And I think all of us collectively need to think about how we bring science more to our instruction in a way that is a match for each learner. And if we do what Steve said and kind of broaden our perspective around the whole climate of the school and climate of learning, then and thinking about equity, we're going to be able to do that.
Awesome. And so I'm going to put all of the panelists on alert. So here's what we know. It has to have the bookend effect. We have been talking almost 90 minutes, and people will remember probably the first thing that they heard you say and maybe the last thing they heard you say. And so I want you to think about your 30 to 60 second kind of elevator pitch that if they have forgotten everything else we have said across this panel this afternoon, what is your most powerful, engaging statement that you want the audience to take away from you today? So Tatiana, I'm going to start with you.
Thank you, Delphine. You know what, I would like to go back to what you said earlier, that districts who have effectively engaged with families in authentic ways before the pandemic were able to adjust essentially seamlessly to the virtual environment or the transitional fluid environment when the COVID-19 shut down school buildings. Last year, unfortunately, many schools and communities, especially communities impacted by perceiving socioeconomic, education, health, and safety, as well as racial inequities, struggled tremendously. And that was not really an environment to start building, learning how to build attendas. We know that to prepare for a crisis, for the storm, you need to learn to build. You need to learn how to build a tent in the weather with blue skies. But we need to draw from the many lessons from this pandemic, the ones that I've shared and the one of my co-panelists shared on this session this afternoon, and to strategically shift and reframe intentional and meaningful connections between schools and families to help ramp up and intensify family and stakeholder engagement efforts to guide the future ahead of us, to reimagine and redesign the education system as we've known it before pandemic. And I would like to leave us all today with a motto that I live by every day. The motto of SPAN Parent Advocacy Network here in New Jersey is empowered families, educated, engaged, effective. Thank you so much again.
Thank you, Dr. Steve. What's your bookend comment?
Yes, so I think there's two parts to it for me. One is that we really need to look at the whole child, right? We need to look at the influence, the interaction between the academic behavior, because one influences the other. So that's really important, not to separate those out, but to connect them in instruction and our educational programming. The second part takeaway is We really need to set up systems to support educators to do that correctly, consistently over time. Because if we can have the best programs that we're adopting, but if they're not implemented correctly or well, our students just aren't going to benefit from that. So we need to support our students. We need to support our staff as well.
Thank you. And Dr. Doug?
I would say that I know this is going to be a little bit unorthodox, but I'll tell you something that I really truly believe. That virtually all Americans love their own children. Not enough Americans love other people's children. And I think what we Americans need to do is to demand excellence from our schools, support our schools so they can deliver on excellence. And that without that commitment, we've got a really rough road to hoe.
Thank you so much for that powerful statement. And Dr. Lisa?
Well, I can't really follow what Doug has shared. That's so powerful. I guess I want to say is let's bring the best of what we know to bear as we welcome children and family back to school, children, students, youth, families back to schools. And it's not returning to how we did it before and everything's back to normal, but let's do it differently. Let's be ready. Let's rethink as we welcome folks back and work really hard to help make sure that children are successful and we achieve outcomes for each and every student and child.
Awesome, awesome. And I like to help people really think about some, and I'm not even sure if it's some, but some of our students will be successful despite us. I'm sure we're thinking about some of those days in the classroom and it probably didn't go well, but students actually learn. But most of our students will be successful because of us. And so what that means is when we're talking about the under-resourced, the underserved, many of those students will be successful because we are successful, because we are predictable. And I'm going to end on this note because it literally brings a tear to my eyes as I just listened to the panel and thought about what Dr. Doug just said. You know, I often tell people I'm a parent, and just as you heard the secretary speak about this morning, because it's probably my most proudest role, but my hardest role. And I remind people, if it's not good enough for Mason, for Miles, for Megan, it's not good enough for your child either. And I think that's essentially what we heard this afternoon. There cannot be the haves and the have-nots. There cannot be what I fight for my child, but what's good enough for your child. And just in closing, a couple of years ago, my child was in kindergarten, and I would put these great notes in his backpack because that's what you do, family engagement, Tatiana. You talk back to the teacher. And about a couple of weeks in, I recognized that none of my notes were being read by the teacher. And I'm sitting there in curriculum night, and she says, if you want me to read something, you need to put it in the binder. The binder is handed off to a paraprofessional. Teachers don't go into backpacks. And it was a paralyzing moment for me as I thought about the thousands and thousands, millions of backpacks that are unpacked every day in school. I'm not talking about unpacked to see if you have pencils and paper and your homework. I'm talking about the invisible baggage that children bring to school. And so now we have an unprecedented time with the pandemic. And yet again, we must be able to build systems to provide the continuity of services and supports to make sure that there is not one kid in this nation who attends school for 170 days, 80 days, 90 days, all year long, and never has that backpack unpacked. And if we're sitting here saying what's in your backpack doesn't matter, it only matters what you can do on a test, we are kidding ourselves. We have said time and time again this afternoon that the non-academic factors matter just as much as the academic factors. So I want you in your own place, give a round of applause for the panelists. They were dynamite this afternoon. tell them how great they are. Tell them how much you have enjoyed today's sharing, and don't be shy. These are national, international experts. You know how to find them. So even after today, when you have questions, reach out to them, and we just enjoy the opportunity to bring this to you up front and central this afternoon and just share this great information with you. So without any more to say, there aren't any questions. I think we're actually giving you about 4 minutes back in your schedule. So awesome, awesome. Thank you to each of the panelists.
Thank you.